This budget hearing conducted by the Committee on Appropriation and Adjudication will now reconvene with the Department of Public Health and Social Services. I want to thank my two colleagues for having joined me this morning, the Vice Speaker and Senator Merrick Camacho Torres. Mr. Casil, I thank you. I didn't expect that all your division heads would all be here at the same time. Acknowledging the size of the Department of Public Health and wanting to respect the fact that I know you have plenty to do rather than sit in the Legislative Hall for 8 hours. I purposely broke you all down into different divisions so that you would come when your division was scheduled, so that you wouldn't sit here from 9:30 in the morning until we handled senior citizens at 4 o'clock this afternoon. But I thought it was clear with the scheduling that I had broken it down purposely, but it's the department. I'll spare you the speech because I recognize the importance that is placed in the Department of Public Health and Social Services, and we have numerous questions, but you may do your presentation. Mr. Casil.
Thank you, Mr. Speaker. Yes, I realize that, but I think I just asked them to, maybe in this beginning they'll all be here just to kind of give us an overview. Then as we, I guess, get into the hearings, then they won't be here the whole day. But I do want them to be available should there be specific questions on the programs that we can't answer. They'll be available, and I still feel that it's a good training for them, to get exposed to our budget, especially with their programs. So I hope you don't mind, and they won't be here for the whole day. You'll see.
Well, no, they will be here all day because we will have to go through each one of them and yes, specifically deal with each one separately. So,
okay, thank you. And anyway, good morning and half a day, everyone. Speaker Cruz and members of the Committee on Appropriation and Adjudication, thank you for the opportunity to present our proposed fiscal year 2019 budget request for the Department of Public Health and Social Services. I am Leo Casil, the Acting Director of the Department of Public Health and Social Services. With me are my division heads who will be representing and answering your questions when their individual budget and programs arise. I also have with me the other staff that are in the program also will be available when needed. Can we have a slide? Oh. Okay, next slide, please. Ooh, small. Okay, presented herewith to start is the department's organizational chart. Just to give you a brief overview, and you can see it as we go through our program. So it gives you an idea what we have, our divisions, and the programs under it, and the protocols. The mission of the Department of Public Health: to assist the people of Guam in achieving and maintaining their highest levels of independence and self-sufficiency in health and social welfare. The department serves the people of Guam and accomplishes its mission by 1. Establishing and enforcing standards, licensure requirements, and regulations necessary to ensure protection of the public. 2. Providing services that addresses identified health needs of focusing on prevention, early detection, and treatment of health problems that are acceptable, accessible, available, and affordable to the target population. 3. Conducting surveillance and monitoring activities necessary to ensure the prevention and early identification of health and social problems. Providing information and opportunities needed to make informed decisions about the lifestyles and well-being of the people of Guam. Developing programs to strengthen public, private, and traditional community supports and resources to ensure residents maintain a minimum standard to living to strengthen family life and to encourage economic self-sufficiency, promoting programs that foster independence among older citizens, providing leadership and direction in the areas of environmental health, consumer protection, communicable disease control, vital statistics, Medicaid, medically indigent program, foster care, services for the elderly, food stamps, and the various public assistance programs. DPHSS is a line agency within the executive branch of the government of the Guam that is responsible for administering programs and services promoting primary care, public health, environmental health, welfare and social services, and senior services. The department has oversight over the Guam Community Health Centers and from the north and the south. The Guam Community Health Centers, federally qualified high centers, are multi-specialty primary care clinics. DPHSS is organized into 5 divisions. We have the Division of General Administration, Division of Public Health, Division of Environmental Health, the Division of Senior Citizens, and the Division of Public Welfare. And as you can see from our what we had on our organizational chart, these divisions are further organized into bureaus, programs, and sections as applicable. The department is one of the major providers of health and social services to the island's residents. We serve the taxpayers by administering programs and providing services to the island community with welfare benefits and program assistance such as Medicaid and MIP, licensing of child care facilities and foster care homes, child protective services, administration of health and sanitary certificates, immunizations, issuance of birth and death certificates, marriage licenses, prevention and control of communicable diseases, services for women, infant, and children, and administration of aging programs to include Title III Older Americans Act services, adult protective services, and Medicare assistance. Our total fiscal year 2009 budget ceiling levels from the general and special funds are provided by the Bureau of Budget and Management Research as follows. In my table for fiscal year 2019, the general fund totals $58,408,408. Special funds total $6,282,099 for a total of $64,690,507. Please stay with the pie charts for a minute. If you can look at the pie charts here, I have just a brief explanation of the first one is the funding allocations of the $58,404,408. And as you can see from the pie chart on the general fund by division, the biggest allocation, of course, is public welfare with $41,676,743. And in total budget from the general fund, $7.902118 is for personal benefits, and the balance of the $50,506,290 are for operations and utilities. So that would make up the allocation and the expenditures on how the allocations are made. On the special funds, totaling $6,282,099 as allocated, illustrated from the pie chart. The Health Insurance Fund showing the largest percentage at 69%, or $4,326,741. Environmental Health Fund at 20%, or $1.33734. Health Professional Licensing Office and Office of the Vital Statistics are all equal with 4% each, are $256,382 and $257,962 respectively. And with the Department of Sanitary Inspection, it is the least at 2%, or with a category expenditure of $137,280. Expenditures for the special funds have also been combined from all divisions in which total salaries and benefits totals $5.425314, and the balance of $856,705 are for operations. So on the pie chart, just briefly mention the allocations to the divisions are separately allocated, but when we get to these expenditures by category, as you notice, we've combined all the expenditures by each category, which will also total up to 58 million. In our budget request, the total number of employees from the general and special funds is 274, in which 141 employees are existing employees funded from the general fund, and 71 are existing positions funded from special funds. Also included from the total are vacant positions, of which 56 are funded from the general fund and 6 from special funds. So the total of 274, you add the components, 141, 171, 56, and 6 should equal 274. Now, not included in our budget request are 109 existing positions funded from federal funds. Please note that there may be a difference in the number of employees for existing and vacant positions since the submission of our budget request to the current day. As of now, we have ongoing recruitment going on, so whatever was submitted when we started might differ, but we'll be glad to reconcile the numbers with you and your committee if you desire. Also not included in our budget request are federal funds anticipated for 2019, in which the Department of Public Health and Social Services receives totaling $196,321,399, of which $150,339,884 are 100% federally funded, and the balance of $45,981,515 are federally matched funds. So altogether, our budget with all the funds totals $261,011,906, of which local funds again totals $58,408,408, special funds total $6,282,099, and the total federal funds at this time is is estimated at $196,321,399. So with my general presentation, Mr. Speaker, thank you. That's what I have in general, and however you want to conduct the meeting, we can go next to or else you can have questions in general. However you want to do it.
No, I will. They may sit here, but we will go through our questions by division.
Okay.
Because we have numerous questions. As big as your department is, as important it is, we need to get all this information because some of the information that's provided in the budget is
Definitely, sure.
some of it's incomprehensible or unclear, and we need to get clarification. So I will go in the order that I have scheduled everybody, and so
we can disperse.
If the rest of them want to, we can all try to do it all this morning if we can, since they're all here. But I just, in deference to their important jobs, I didn't want them all to sit here. But if you want them to, then we'll go through. We'll go through your division. When we're done, we'll go to the next division. Because the one thing I hated in public hearings was having a whole room filled with people that weren't doing anything, and I wanted them to be constructive in their various jobs. But I'll ask my questions as it relates to the department, the administration. The other colleagues will ask. Then we'll move to what was scheduled next, and then we'll move to the next one, and we'll go in order. Okay? In your budget, the Division of General Administration proposes a $3.5 million option 1, and in option 2, the Division of General Administration is $3.2 million. Will you be able to operate under option 2 in Division of Administration with the 3.2 million, or would that be
You know,
too much of a
Senator,
cut?
let me see, that difference, the total difference from there,
It's only 300,000, but I'm just wondering,
300,000.
it is a 10%,
yes.
so I'm wondering whether or not you'd be able to.
It'll be difficult, really. I mean, you know, we went back and we identified areas where we can reduce and where it might have the least impact. And for the administration area, you know, we targeted the positions that were not filled, and you know, and reduce some.
Of that 300,000, what of that $300,000 difference? What is absolutely imperative?
Yes, that will what we will have to, I guess, as you mentioned, to to work with less $300,000. It's, you know, we have to detail all of that.
I understand, but if you could at least justify it and tell me the 300,000 is for this, this, and this, then I'll have the ability to be able to say, all right, to fund this additional 300,000.
Well, you know, I mean, if we have no choice, Mr. Speaker, then we'll live with that. That's all I can say.
Okay,
You know, but
as I said, I'm doing a zero-based budgeting. You're
Okay.
going to have to justify every dollar that you're getting.
okay.
The difference, if you're not going to explain to me what is imperative in that 300, then I have nothing on which to base myself on.
Just the one thing.
You know, it'll appear as 300
Turn on the mic.
less. However,
Wait, you need to turn on the mic. Go ahead.
Introduce yourself.
oh, my name is Tommy Tidegui. I'm the Administrative Services Officer for the department. You know, if we had a comparison of how we're operating today, it'd be roughly around 700,000 less with that 3.2 million budget.
See, I was not the one that presented the budget, okay? This was sent down by the administration.
Yes.
So I need for you to explain to me what the difference is between option 1 and option 2, and why it's imperative that this legislature consider option 1 rather than option 2. But if you can't tell me what it's for, and I'm not going to be a dentist and pull it out tooth by tooth, tell me, otherwise we're moving on. What's that 300,000 made up?
What would be affected the most would be the services in terms of like our planned services for the facility. We would have to reduce the preventive maintenance of like our equipment, our facility equipment, and
Slide the mic closer to yourself so we can get it recorded. Just slide the microphone closer.
it would affect mostly like the positions to begin with. We didn't fund no positions and we didn't fund no vacant positions in option 1 as we did with option 2. When we went into option 2, we cut further into the services, the contractual services area, and we reduced it by like $129,000.
And what's in the contractual services that's imperative?
The maintenance of the equipment. We did propose to paint the facility. Facility hasn't been painted since like over a decade.
And how much would the painting cost?
We estimated like at $60,000.
And in these dire financial times, is the painting of the facility imperative at this time, or can that be put off another year Okay.
Yeah.
These are the
I'm going to move on.
Yeah, those are the
Under-
items that we deducted, like you said, because of the the priorities. So things like for the painting, for the. By the way, the generator, we have no generator, but we were able to get some funding from federal funds. We were going to pursue that, but it's like over 200 some thousand, so that was out. So maintenance for generators was also taken out because we don't have a generator. So those are the item categories that we looked at and which we were able to reduce and for us to to use it for the other operational expenses.
Okay. I'll go through my questions. Under the Health and Professional Licensing Office, there's a request for travel for $6,731 for 2 board members to attend the annual board conference. Is it imperative that both go, or can one go, or how much is absolutely necessary for that one?
Good morning. My name's Marlene Carbolito, and I'm the acting administrator for the Health Professional Licensing Office, and I can answer that question. Normally, we go through travel. The board members are approved for travel through the national associations we're affiliated with, but for some boards, they don't have the travel funds. For instance, optometry board. They haven't been able to attend their National Association board meetings because they don't have funds from the National Association for travel. So that's where the government of Guam has to step in and sponsor them to go.
And
Pay
that's
for
the
their travel.
$6,700?
Yeah, because if you know, travel is very expensive coming out of Guam.
I understand, and I'm trying to
Yeah.
figure out, is it just that one board that you're considering in this?
No, we have optometry board, cosmetology board. There's 9 boards. So not all of them have national associations that sponsor their annual meetings.
There's a
And if
request-
they do, sir, sometimes like medical board, they limit the funding. Like they only have a scholarship for $1,800, so the board member has to pay the other remaining funds for per diem, for hotel, food, and airline travel.
There is a request to fund the vacant director position under the, I understand you're filling this slot as the acting. Is the position on not funding the deputy position, what is your position on not funding a deputy position in the department?
No, what it is the director's positions will have to be funded. It's vacant right now, but of course that's in the anticipation for next fiscal year. Whoever the administration is, we're anticipating that it will be filled. But the deputy director, which is filled. So that's what it is.
I guess
we want to keep it.
my question was inartfully worded. In the event that we have to do some major cutting, is it imperative that with the very capable division heads that you have in the various divisions, is it imperative that we fund both deputy and the director, or can we have a director with the very capable division heads serving in their capacities?
Mr. Speaker, from our experience when we came in, I know they didn't have a deputy, but they had a director, and we felt that, because of the bigness of the department, we're over 400 some employees, we have over 160 programs or what, we do need a deputy and a director, because the director is always in demand for whatever meetings, whatever request they have, and I know when Mr. Gillen was on board, he did a lot of those things. Well, I stayed behind in operations. Sometimes I wanted to go, but we made that's a compromise. I am the whatever stay behind should there be a need, so that we can expedite things.
And
so
that's
I really
that's
think
the justification that I wanted, and so I'm just, I hope they give me a honorary DDS as a dentist, pulling this out of you one by one. Under the Director's Office, there's also a request for public awareness, Employee Recognition Week, 10,000. Is that imperative?
No. I mean, if we have to do without it, we can. But it's a part of, I guess, providing incentive.
Thank you. Under the Director's Office, there's also a request for 50,000 for miscellaneous for the Medical Director Bonus Incentive.
Yeah.
What, can you explain that?
That's a contract that, by law to,
There's a mandate in place to provide for, as an incentive for the medical director. As that position, the whole intent of that mandate was put together was to provide incentive for a physician to step up and act as the medical director. Now it's up to $50,000, and we choose to do it award quarterly, and it's been difficult for us because we have to put together justification in order to even process the personnel request to award that incentive.
Has that been provided in the last fiscal year?
The last fiscal year, if I'm not mistaken, like 2/4 of it.
It was.
it was provided, yes.
Was it provided for the entire fiscal year? Because I thought I heard that that it wasn't initially. Is that correct?
No, Mr. Speaker, it's been provided. You know, the difficulty we have is when you read the law, right? It's very specific, and I think Senator Rodriguez was the one that introduced that. You know, when you start saying we have to justify the doctors, not just the regular.
No,
right?
I understand. I understand, and the legislature did approve the amount. My question is, was that provided to the medical director? Because it was my understanding that it had not.
Oh yeah, Well, you know, the problem is, it's not an automatic. Here's 50,000 for you. Like you say, it has to be done to be justified, and we did it through on a quarterly basis because of the job that requires. But we have provided it, so as far as I know. Right, Tom? We have provided it.
I know for a fact this fiscal year we processed for 2 quarters.
Yeah,
The first quarter and the second
even last
quarter.
year.
Okay, good, because I
Yeah.
get all kinds of strange information.
I can get confirmation.
No,
No.
I'm just saying, that I heard that it hadn't, or there was question that whether or not it had. So
For corrections,
you have it 50,000.
she has been paid what we owed her. I mean, it must have been delayed for some reason because of paperwork, but the back pay I know that she was claiming, we have provided payments to her. Okay?
Under the Facilities and Maintenance Program, there's also $226,000 for security services. What is that? What is that?
Where's that at?
200 security services. Do you guys have a security agency?
Yes.
Oh, yeah.
We provide security services for the facility after hours and on the weekends, 24 hours, and the holidays, 24 hours. And that's for all 3 facilities.
And okay. And that's contracted out to someone for $226,000.
Yes. Bid it out and contracted out. Then.
Also, under management support services, there's a $7,600 for staff development. What's that?
Training. We use that to augment other division staff that perhaps may not have the funding. Within our division, we do send folks to like the procurement basic training that's in place.
Okay. There's also, under the supply section, there's vehicle lease. 8,600. I know it seems minuscule but when trying to balance this budget, we're looking for every dollar, so.
In option 2, that's one of the areas that we didn't fund, was the vehicle lease for both the management support services section and then also the supply section. Right now, currently, they're using automobiles that have been surveyed by the other bureaus or other divisions that are operable. All they require is maintenance, frequent maintenance. So,
I understand, and I know the GSA, at least one of the other departments told me there's a parking lot full of vehicles down at GSA and wanting to have access to them. Do you absolutely need a lease, or can there be something else worked out in this capacity?
Speaker, like what Tom said, within our program, we've been borrowing and using other programs where their vehicles are not maybe operable in their standards. So we've taken them and did repairs on them, and that's what we're using now. The problem we have with that is, of course, their age and sometimes they frequently need maintenance. So we go ahead and repair it. So that's how we've been doing. And the reason why we want to lease is so that we can prevent all this maintenance every now and then because of the age of the vehicle. But like you said, though, if we can do away with the old vehicles that we have, I know we have a pickup from the Division of Senior Citizens, and we have a van from I believe Chief Public Health Officer.
Yeah,
so that's how we're doing it.
In the administration division,
That's how
you're borrowing cars from others that have money to be able to purchase vehicles, and so I'm just wondering, is giving the administration division a lease imperative? Okay. There's $127,000 for PHRO software maintenance. What's that?
that's the portion of, the local portion of the PH Pro module for the Environmental Health Division, and that's usually paid for by this program account.
Okay, so you pay for it under administration as opposed to under environmental?
Yes.
Okay. And also, under Health Professional Licensing Office, you have $175,000 for comprehensive management services for online licensing, certification, and tracking systems.
There's an ongoing effort right now to acquire automated system for the licensing offices, the licensing boards, and we're going through. Right now, we're at the stage where we're researching and then working with putting together an RFP through Marlene's office or the HPLO office.
How was this amount arrived at?
I'm sorry, sir, what was your question?
How is the amount of $175,012 seeming like very exact, not $175,000, but it's seemingly like I know it's exactly $175,012, not $175,011.
Because we've done our market research and we've gone to several vendors, and that was the top quote that we received from a local vendor just to get an online system for the board so that people can come in and they don't have to come into the office. They can just do it from their home, submit an application, and expedite their licenses. So it's a management system for all the boards. So that amount we came up with is actually one of the quotations that we received from a local vendor.
And how far along are you in this process? And
We are
is it
preparing the
imperative at this time?
RFP, but not anybody can prepare an RFP. They have to go through this procurement class for procurement purposes to make sure that, they're doing the process correctly. And just to let you know, it's been a very hard process. We've been working on it for at least the past 5 years.
Which reminds me, I was the author of the requirement to go to this class. How many employees of the Department of Public Health and Social Services, with all the contracts that you have and procurement that you have, how many and who has completed the procurement class so that we no longer have procurement issues?
Hi, good morning, Senator. My name is Bertha Tyrant. I'm a program coordinator for the Director's Office. We've been sending our staff to the procurement training ever since we found out about the law. As a matter of fact, we have identified at least maybe over 40 staff that have been trained. But just keep in mind that what Marlene said earlier, that in order to process an RFP, you need to take all 4 procurement modules. So our staff have been signing up for the modules based on their availability. We do have some staff from the different divisions that have completed the 4 modules.
How many employees in the Department of Public Health and Social Services have completed all 4 modules?
I believe there's only 2, or no. Oh, from one division there's 2, but I want to say about 6 total, maybe?
Yes, about 6 total.
But we do have staff that are currently enrolled in procurement module 3 right now.
Mr. Speaker, when we found that out from the AG's office that they will not entertain individuals that don't have all 4 modules, well, we looked into, because it's administered by GCC, and apparently because of the scheduling or whatever, I think that's where the gap is at. I was able to talk to Mr. Brown and Jerry Paris, and I've been asked them if they could independently, we can hire them to teach us for all that, but they said we have to go through GCC. Yeah. So we have a lag there. Okay,
for as big as your department is and as many contracts as you guys go through, it really is imperative, especially every time I have to suffer a call that a procurement has failed and there is a problem. I didn't get that law passed to give Jerry Paris and Mr. Brown a job. I got that law passed in the hopes of trying to provide the training for everyone, even if it was forced, to understand the intricacies of procurement and what to do so that you don't get a protest and have to do an emergency after emergency after emergency every single year. So I really hope that you're going to have people complete the 3rd one and get into the 4th one and expand that number, because as of October 1st, no one is supposed to be doing anything if they haven't done the 4th.
Can I just say that one of the challenges that we face is the courses that are offered is open not only to Government of Guam employees, but to the students as well. And the autonomous agencies have more of an advantage because they can process their procurement documents in advance. With the line agencies, the requisition to turn into a purchase order takes some time to process, and GCC is on a first-come, first-served basis. So even if we have a purchase order being processed in the system, they won't confirm our staff to attend unless they have a purchase order in hand. So what we did was we requested from GCC to hold a training just for our department. It's really based on the instructor's availability, and that's something we're working with GCC moving forward.
Okay. Do you have any questions? Dennis? Do you have any questions?
So in the administration division, there's not like central procurement? Each division procures for themselves?
Yes, you're
That's the
correct.
model? That's
For-
why there
for
are
the most,
40,
yes.
you need 40 to be trained?
Yes, and the fact that we don't have as many individuals that have completed the 4 modules, it doesn't prevent us from preparing an RFP. When an RFP is prepared, they're usually prepared through a committee, and as long as one individual within that committee had completed the 4 modules, we would be allowed
Yes.
to move forward.
That makes sense. That's why I'm wondering why this is taking 2 years for that. Well, why is that if there's a committee that's qualified to do it?
Well, at this stage, she's in that process. The individual that's working with the RFP specifications right now, she's forming her RFP committee, and I made it known that yes, she did have to have somebody within that committee that had completed the 4 modules.
All right. I noticed that between option 1 and option 2, of course, there's a difference in personnel, but does this require then, to get to option 2, you would have to cut existing personnel or just not fill vacancies that you're
Just
trying
not
to?
fill vacancies at all.
And then and then you said contractual you were going to reduce in option 2. You would
Yes.
have to reduce, okay. Maintenance of equipment and painting of the building and
As
the
well as-
generator maintenance.
As well as supplies.
Supplies, okay. All right. Thank you, Mr.
Okay. I think we can move on. I guess my timing was a little off. I thought there'd be more questions, and we can move to Tess.
Thank you, Mr. Speaker. Mr. Speaker, may I request that the ESO and myself stay with, with
Oh.
Alda? Okay.
Please. I just didn't want to, please.
No, we're here
They
to
can all
assist them
stay.
also.
They can all stay, and it's just that I wanted to respect their ability to be able to continue their very important functions. I just didn't want them sitting. I know my colleagues aren't happy about this, but I didn't want them to have, they don't all have to leave, but yeah, I just didn't want to keep you guys waiting. We would, go ahead. If they want to, unless they want, they all came down early. I'm tired.
Mr. Casil? No,
okay,
Mr.
the
Casil,
next-
if we can request,
sorry.
we ask the chair, I know the chair scheduled their hearings for later on, but if they're here and they're willing to stay, I think the chair is willing to accommodate them now. After, we'll just go over. So you can call them back, at least your division heads, if they're willing to.
If
They may
want-
still be out there.
Okay.
Good morning, Mr. Speaker and Senators. Thank you for allowing us to present our budget requests for 2019.
You need to get closer, okay?
Okay. Slide, please. The Division of Public Welfare provides assistance to low-income individuals and families. DPW programs provide a safety net to individuals and families to protect them from poverty. The division administers several federal and local programs that provides benefits for health care, child care, and basic necessities such as food. The common element to all the programs is that they are means-tested, and in order to qualify for benefits, the individuals and families must meet the program's defined income level, resource criteria, and other eligibility requirements, with the exception of Title 20 and foster care program. The means tested levels are unique per program. Income above the means tested level means the individual or families does not qualify for benefits. The division's mission is to promote positive social conditions that contribute toward the attainment of the highest social well-being of the economically and socially disadvantaged populations within the territory of Guam. By developing an efficient and effective delivery system of services to eligible clients within the territory, by determining eligibility of applicants, by administering payments and various social services to remove social barriers which prevent persons from obtaining or maintaining the basic necessities of life, to include safe and decent housing, medical care, nutritious foods, and employment status. The division is comprised of, it shows our organizational chart headed by our Deputy Director and Director. The division is comprised of 4 bureaus, namely Bureau of Economic Security, as requested in your, next slide please, as requested in your letter. We identify, we indicated in that slides all the programs. So for Bureau of Economic Security, we have Supplemental Nutrition Assistance Program, which administers several programs serving low-income individuals and families. The Bureau's function is to determine and certify eligibility. SNAP administration is 50% federal and 50% locally funded. The program offers nutrition assistance to the disadvantaged population on our island and provides economic benefits to our communities. SNAP is the largest program in the domestic hunger safety net. Then we have the cash assistance program, which includes TANF, old age assistance, assistance to permanently and totally disabled, and aid to the blind. TANF provides assistance to needy families with children and provides parents with job preparation, work placement assistance, and support services to enable them to leave the program and become self-sufficient. Then we have also the medical assistance program, which are Medicaid and medically indigent program. Next slide, please. Included there, as per your request, are the program metrics, which includes program mandates, application processing, and so on. It's in your file. Next slide, please. Then we have the Bureau of Social Services and Administration. It administers various child welfare programs designed to protect children and strengthen families. Services provided are funded and regulated primarily by the federal government and applicable local laws. BOSA provides child protective services, case management, foster care, family preservation and support services, adoption home studies, child custody home studies, and child care licensing and monitoring, and family foster home licensing services. It is also responsible for providing services to the homeless population on Guam, aside from providing child protective services. That is in accordance with Title 10 GCA Division 1, Chapter 17, and Division 4, Chapter 88. Also, the metrics are included there. Then we have, next slide please. Then we have the Bureau of Management Support. BMS is responsible for the eligibility determination, coordination, and monitoring compliance of federal mandates of the Child Care Development Fund, ensuring the state plan is timely implemented, program contracts are in place, and eligible families are afforded an opportunity to choose and access quality child care to enable such families to maintain employment or continue their education. It is responsible for implementing and operating SNAP quality control, conducting management reviews on SNAP also, conducting investigation on complaints of abuse and misuse of the SNAP benefits and public assistance benefits, and the collection of claims made against households found to have violated the program's rules and regulations. Also, it assists individuals under TANF program to achieve employment and make available support services, which consists of conducting initial assessment, coordinating the provision of jobs components and support services on behalf of participants, and conducting follow-ups and assist SNAP recipients obtain marketable work skills to ensure success in the job market and to minimize dependency on public assistance. Next slide, please. Those are the metrics, core metrics to achieve the core missions of BMS, of the Bureau of Management Support. Next slide, please. Then we have the Bureau of Healthcare Financing Administration. Of course, they administers the benefits and coordination of medical assistance program, which includes Medicaid or Title 19 of the Social Security Act. And then we have the Children's Health Insurance Program, which pays for children's medical services as an expansion of Medicaid. Then we have the Medically Indigent Program of Public Law 2730. And then we have the EAP, or the Medicare Modernization Act of 2003. Next slide, please. Those are the metrics to meet or to achieve the core mission of the Bureau. Next slide, please. Presenting to you are the historical data of the division. As you can see, the total number of eligibles we serve from fiscal year 2014 to fiscal year 2017. Those are the programs and those are the number of eligibles that the division served. Then we have, next slide please. Then we have by household. As you can see, SNAP program alone has 18,000 household or families that the division serve. And then we have the TANF program, the Medicaid is 17,000, and then we have CCDF also as 1,000. Next slide, please. For CPS, we also have data. We're showing to you the number of children under CPS custody. As you can see, in 2014, there's 236, and in 2017, there's 247 under CPS custody. Next slide, please. Next slide, please. Oh, okay. The slide shows you the benefits that the SNAP, the Supplemental Nutrition Assistance Program, issued to its recipients. That is 100% federally funded. So as you can see, in 2014, we have 113 million that is infused into this economy. And in 2015, 16, and in 2017, it's 103 million that SNAP infused into our economy. Currently, for fiscal year 2018, we have already issued 74 million, 74.6 million as of June. Next slide, please. Then for cash assistance program, this is not 100% because the old age, it's only TANF, that's 100%. This includes all cash assistance, which includes GA, which is locally funded, and then we have also the old age assistance, aid to permanently disabled, which is 25% local. So all in all, we issued 3.2 million in 2017. Currently, as of June, we have issued 2.3 million. Then we have CCDF. CCDF is also 100% federal. We have issued 4 million in 2017. Currently, we issued 3 million currently as of June of this year. Next slide, please. Then we have the Medicaid program. Total expenditure for 4 years, and then we have the 2017, which is 108 million. That comprises Medicaid, CHIP, EAP, and the childless adult. Currently, we have spent 78 million. Our expenditure is 78 million as of today. 3.6 million is unpaid. Then we have the medically indigent program. In 2017, we have spent 9 million for the MIP program. Even though the appropriation under MIP is 16 million in 2017, we utilized that money to pay to match the federal, because the MIP ER, which includes inpatient services, hemodialysis, and then delivery and other emergency services of MIP, is chargeable to the Medicaid program. So instead of paying it 100% under the locally funded program, we took that money to match the Medicaid and charge it to the Medicaid program. I have a history, if you want that, Senator, of how much MIP was paid under the Medicaid. So currently, we have paid 8 million under MIP for 2018. Next slide, please. That slide shows the summary of Division of Public Welfare fiscal year 2017 expenditures. As you can see, the total benefits and payments issued by the division is 233 million, which is 95% of the total budget of the division. And then the total admin is 5% only. 3% of that 5%, which is 7.6 million, is only for personnel, and then 2% is for the operation. So, based on the information provided, the division served an average of 63 clients unduplicated yearly. This is about 38% of the estimated population on Guam. The average total benefits and provider payments issued yearly is more than 230 million. This amount is being infused into Guam's economy. Of the 230 million, 43 million is local. Medicaid and SNAP administrative funding requires 50% local match. Though the admin is 50% locally funded, the benefits issued by SNAP is 100% federally funded, and the Medicaid and the CHIP federal matches are between 55 to 91.5%. SNAP alone infused 103 million federal dollars into Guam's economy. The slowly dwindling economy of Guam is highly dependent on unreliable tourism industry. We think that continuous receipt of federal funds is a more stable income. The implementation of new and existing program mandates, program monitoring to ensure program compliance, reporting requirements, the number of new and existing clients that the Division of Public Welfare staff entertain or process, and the voluminous medical claims that staff receive and process for payments are overwhelming. Recruitment of all the funded vacant position is essential to accomplish the division's mission of providing human services to the disadvantaged population on our island. For the record, the proposed fiscal year 2019 budget request submitted by Division of Public Welfare is based on the budget ceiling provided to the department. Attached is the DPW budget request for fiscal year 2019 by program and by category as requested, including the total amount of requested position filled and vacant positions. So on the next page, it shows, on the next slide, it shows the proposed DPW fiscal year 2019 budget request by object category. As you can see, the salary is 3 million, travel is 284. That is for our clients' travel and employee travel. Contractual services is 4.6 million. Office rental is 204,000. Supplies is 141,000. Equipment is 19,000. Drug testing, grant or sub-recipient is 12,206. Utilities is 59,765. Then we have a capital outlay of 50,000, and the miscellaneous is 33 million. In total, 41.6 million requests for local budget. That's the end of my presentation, Senator.
Thank you very much. Each one of your bureaus is actually bigger than most departments. I'm sure the Vice Speaker could spend an afternoon just asking questions of BOSA. I know she had a special meeting with them earlier this year. And so, but it really is a very huge and very important division within the department. And as you put it, the amount of money that you infuse into the community is extraordinary. Which is the reason why the budget was very confusing for me. I know that I said in this zero-based budgeting that I wasn't going to look at what was appropriated last year and as a guide for what is going to be addressed this year. But the thing that I couldn't understand was last year we appropriated for this division 143 million just for local funds, general fund. But then in the budget under option 1, the recommendation is 85 million. And for option 2, it's 81 million. And though I wish I could find a $40 million savings that way, it would make things easy. I was trying to figure out how is that possible? And then I go and I look at the budget digest, and where last year we appropriated $35,517,483 to the Medicaid program, option 1 and option 2 listed at 0. I was trying to. And then for Medicaid assistance program, the childless adult program, we appropriated 18 million last year. And then option 1 and option 2 this year is 0. How is that possible, and who made that decision? Or how is that being addressed?
Speaker, we're just following the budget ceiling provided to us.
But how are you going to be able to manage with 0 in those two, I mean, in those two areas, where last year it was 35, and now under the current budget digest, it's reading 0. Am I reading that correctly?
Yes. On previous years, we were able to find money within the department, so it's like we're really trying to cut budgets within our department and utilize the local funding to match the ACA, the Affordable Care Act funding. Then again, due some of the local match that we utilized in previous years are, of course, from MIP as well as from the pharmaceutical, GMH pharmaceutical. But as you know now, there is another hospital that provides services for inpatient and emergency room. So basically, that pharmaceutical money is not being utilized by the Medicaid or the MIP program. The reason being is because some of the patient or most of the patient goes to the new hospital.
And, but still, how does that read zero? I mean, if I were to just say, all right, Governor, I'll give you your budget, and I present to the floor option 1 or option 2 to my colleagues, there'll be zero appropriation for Medicaid payment and zero for Medicaid assistance. How will the department be able to cover that $53 million difference?
Because in previous years, it was never funded.
Oh.
I look for money to fund the ACA. We look for money to fund the ACA. The
So
department.
you mean I needlessly appropriated $53 million last year, and it was fluff to your department that you used someplace else?
No, Senator.
So where did that $53 million that was appropriated before go? Or am I missing something?
For the Medicaid program, they usually work with what's provided for Medicaid payments. Now, the Medicaid payment that you refer to that's zero is the ACA. The ACA is never provided a direct appropriation. And those funds the local match funds that we use for ACA are from lapse funds that are realized through like the non-recruitment of these vacant positions. This is throughout the department. So on a quarterly, sometimes monthly basis, I have to project what we're going to need, what becomes lapse, what's made available, and from those lapse, she's afforded to that local match for the ACA.
Sure.
So basically, Senator, within our division alone, because of non-recruitment of some of the vacant positions, we utilize that local match. And even for foster payments,
I'm very impressed, and I think several years ago I commended you on your ingenuity in moving people from 100% locally funded or locally paid for to getting creative and sticking them in other areas. And we appreciate that, and we commend it. I don't want it said that I didn't, or that this legislature did not provide for the health care by having an appropriation that did not fund it. I just wanted you to say that you could do with, and you would find somewhere, and then I can move on. I just wanted to ask that question, and then I'll let your oversight chair correct me where I must have misunderstood something.
Senator, we were able to fund those in previous years because of the pharmaceutical funding. That's 11 million. That's a big help. But currently, this fiscal year and the next fiscal year, we won't be able to use that because GMH claims are not that much. So basically, I would say this is the budget ceiling that was given to us.
Mr. Chair, if I can. So just to help clarify and help everyone understand, right? So the ACA funding is separate from the Medicaid funding that we usually provide through the pharmaceutical fund. The ACA funding, though, is limited funding that's only going to be available till next year.
Yes,
correct?
2019.
Okay, so, and you're right, you've done exceptional job, the department has done an exceptional job in finding ways to fund it creatively, right? I know that this body also put together some sort of plan to access that money with an expanded Medicaid program, but that's something we can talk about separately. But so if you can tell us what is remaining from ACA, the amount that's available.
Technically, that ACA should be gone by now. But because of the reauthorization of CHIP, we received 82 million for the last 3 years. We used to receive 5 to 6 million only on the CHIP funding. But the last years, 2016, 17, and now, they increased the CHIP funding. So that 82 million helps reduce the expenditure in ACA. As you know, CHIP is an expansion of Medicaid. If we run out of funding on CHIP, we use the Medicaid or the ACA. So currently, we still have, as of now, 100 million.
And that's for the, so, but the beginning amount was about
268 million.
So 100 million is what you need now, and that runs out if we don't use it by next year.
Yes.
So it's very important. I think what the chairman, correct me if I'm wrong, Mr. Speaker, is that we want to be able to access that, right? And so that's where we're going to have to, because what you're saying now is that in next year, without any funding, we won't be able to access that funds. And so it's very important that we put something together to be able to access that.
Yes. Remember, the matching is 50-50.
That's right.
So that's the hard part.
Yeah.
Yeah, as I
The
understand, the matching is 9
Yeah.
to 91%.
No, that's
it's
for
CHIP.
CHIP. 91.5% federal is CHIP, but the childless adult is 90%. But the regular Medicaid is 55-45. So there are three
And
different-
so, in order to be able to have us access and utilize that 100 million that's going to expire about this
2019.
time next year, as I understand it, in June or July, it has to be all expended. How much do we have to put into the budget for you to match that? What do we have to change the way the farm fund is being done? Is there something else? Is there an appropriation that we have to match? Because it would seem to me that either a 9 for 90 or a 91 or a 10 for 90, even 50-50, how much do we need to take advantage of that so that we can
Well, definitely we will not be able to use all that 100% because of the reauthorization of CHIP. So I would say we would need to match ACA if you can give us an additional 20 million or 18 million to match the ACA.
Okay, 18 million where? In what category should
Local
we
funds,
put
local
that?
funds.
18 million local.
Yes, $18 million into ACA?
Into ACA.
In your budget thing,
From local funds. Yeah.
local funds, where do you want that 18 in
It's to
in
fund,
this?
it's to fund ACA, right? To fund the
As you can
Okay.
see in my presentation, you have a
Yes.
copy. It's there, it's blank. ACA, childless adult. That's where it is.
Where does he want to put it? Budgeted where?
On the budget, it's on Medicaid ACA and childless adult.
And you can specify it if you want to, specifically for ALCA.
Yes, where it's here, it's on my,
Expenditure.
but it's on the budget submitted. It's on the Medicaid ACA and the Medicaid childless adult. But in here, in my summary, it's zero.
And Mr. Chair, the only thing I would ask the department is that, as the chairman is committed to finding a way to do this, is that whatever program it is that this funds, that we try as hard as possible to fund this on the front end, because I know what you've been doing is very good. Is that you move MIP money to the emergency services, right? But that's really the back end. That's when they're already sick. That's when they're in the hospital. So whatever it is, I'm hoping that it could be a program that helps them get the preventative and get the front end services, because that's very important.
But as based on the budget, the MIP money was also reduced in this budget.
Okay.
Yes, I noticed that. And we've had a 10-year running discussion about this. And when I retire, I'll be able to travel for 2 years because you owe me dinner
In Paris.
in Paris and many other places.
Yes, yes, Speaker.
So I thank you for, but I'm a little concerned. I noticed that even this year, I used to scream at you because you reduced what I thought was a $23 million need to 16, or a $21 million need to 15, and now you're asking for 13. Can you explain this to me?
It's because of the budget ceiling, Speaker.
And what would be the amount that you need in that to be able to move around, to creatively use? I mean, and again, I commend you for your creative ingenuity in moving people into the other areas where you can get a 50-50 or even better a 9-to-1 split. How much do we have to put there?
If you can just provide us the same budget as you used to provide us for MIP.
That would be 23.
That's 16.
Okay.
You used to give us for 2016, 15,
Well,
17,
You kept
16.
insisting on 16, and I kept insisting on 23.
Thank you, Senator, if you can give that to us.
You can make it 25.
Thank you, Senator, if you can provide us. I don't want to take too much money from other division.
But when you can invest it the way that you are in making it, the additional
Yes.
5 million to make it 50 million because you matched it 9-to-1. That's, to me, a better use of that 5 million. There are 44 funded vacancies totaling almost $1,900,000.
Yes.
We still need about $1 million locally in order to be able to fill these.
The total vacant positions are 28, so we need 1.2 million to fill up those vacant positions.
Is that all local or as part?
That's all local.
All local. And how many of those positions are necessary for you to be able to move along the ACA and the CHIP and everything else? Because as I understand it, you have a backlog in that?
Yes, currently they're still processing February claims,
And,
Yes.
and this is June?
and it's June. Yes.
And so how many people do you absolutely need in that area?
15.
15. And Mr. Director, I know you, in the beginning, you mentioned that you have some of these positions are being processed.
Yes. In fact,
When were the GG1s sent downtown, and how long has it been since they've not been moved?
Mr. Speaker, for the, we go back, like for the SNAP, if you notice, the number of vacant positions has become 1 now. We did have a challenge there when we, maybe, what was that, maybe just last year, when we had about 13 vacancies, and we were having problems in meeting the service times, posting, we have a lot of people complaining and so on. Well, those positions, I think 10 of them from the SNAP or field were filled thanks to the help of DOA. But what we did was we had to use the LTA concept because it's faster, to get profiles for individuals. And then what we're going to do there is that for 1 year, and these people were profiled to be qualified for elective specialists, for example. So within the year, when we issued the recruitment, then and we already have someone in place there that, so it won't have a lag. So that's what helped. Now, placing the recruitments out, I know Tess is saying that, well, we have 1 year for these people, so the recruitment will continue, and hopefully those people that have experience there already will be on the listing, as it becomes competitive, So that's one. Now the other areas I know, and we talked to Tess, is especially in Medicaid. It's sometimes difficult to help me with this.
It's difficult to recruit.
Yeah.
The reason being is the reviewers requires medical background. Of course, if you're going to review medical claims, we need somebody that has knowledge on terminology, or at least a licensed nurse or a licensed doctors to review, to ensure that the services provided by the physicians are appropriate and medically necessary. As you can see, we also deny claims. You are going to see all our expenditures, the total amount of claims, total charge versus the total payment is really, we reduce.
Yeah, I thought that it needed some very specialized training and experience and knowledge, which was the reason why when, I won't say who it was, but somebody kept insisting that you were saying that all you needed was a high school degree and you would be able to train them up in 2 weeks. I knew that was not correct, though she kept insisting that was what you told her. I kept insisting that would be impossible, because in order to be able to understand what this person was reviewing, they had to have some basic knowledge in medicine or this entire area. And we got into a very lively discussion about it, but I kept thinking, I don't think that's what Tess needed. She needs. So how can we help in that? What is it that needs to be done? Because
we continuously recruit. There are some, but there are some who qualifies, but it depends on DOA and their criteria on how they assess the applications. So because there are some.
Well, Leo, what is the holdup at DOA? It would seem to me that.
Mr. Speaker, what it is first of all, the number of applicants that apply for the reviewers are very limited, okay? And I know there was one time when I think we only had 1 or 3. I said, Tess, get them and see if we can, train or whatever, but they back out. So sometimes we hire them, then they back out. Maybe for some reason, I don't know. But it's just the difficulty in trying to attract in this area. And, because of what you're saying, all the requirements, and maybe they're hearing because we have less staff, there's more work. But, that's because we have less staff. But, that's our difficulty. No, maybe we can lessen. I don't know.
You're saying at this point, do you or do you not have any GG1s
We do.
or recruits waiting at DOA?
Yes, we do.
How many?
For all the vacant positions, we do, even for claims reviewer. But because depends on how DOA staff assess the application, even though they have medical background, but the requirements, it doesn't meet the requirements, so they don't qualify. So there's only, currently, we interviewed just one. It's on continuous recruitment, but they given us a list for the reviewer. The claims specialists not necessarily require a medical background, but at least should have some knowledge on accounting, because it requires, calculation, mathematical or analysis that requires. So based on how they review the application submitted, that's what we get.
Have you worked with President Okada to try to figure out whether or not some of their students, as they're going through their programs, can somehow work for you to earn some money while they're going to school? I mean, it would seem to me that there's a large group of young men and women that are in the LPN or even at the university that are in the accounting and could have a part-time job to assist in moving this through. I mean, I'm trying to figure out how to be able to help you. You owe me so many dinners because I've been trying to help you so.
We can check that, Speaker. We will talk to them and possibly have some students to work with us.
You know, Mr. Speaker, if you know, you have a very good point there, because we also have problems with our nursing staffing, and you know, there's a shortage. Yes, in fact, but we're finding out that even the graduates that just came out from UOG, for example, we want to hire them, but because of the specs, and not only the pay, but the specs sometimes says you require experience. Well, how can those people require experience? So I like to recommend, or we can pursue it within the government, is have some kind of like they do in the private sector, a management training concept, to where it fits into our system, right? We can we do it if the recipient is a scholarship individual, right? We're required to take them in. Well, why can't we do that for just like that? See, and
Please
where can
be as ingenious as Tess in figuring out a way, but please
there you go. See,
get her some assistance in trying to move these things through, because though I'll be gone next year,
you can stay some more.
I would just go crazy thinking that we're going to return $100 million.
Finish this first, and then you can go, sir.
$100 million. How could we, just say thank you and send it back to Washington, D.C.? I mean, I just don't know. And you very quickly glossed over a comment during your testimony. And I think it's important so that when people look at the listing online, because all the testimonies online, can you please explain again the travel that you have for Medicaid? Because when you read your testimony, you said this is for our patients. When you said,
yes.
So you have to make that clear, because otherwise somebody looking at that is going to think that
Yes.
you're trying to compete with Gita in traveling, but actually this is for your patients.
Yes.
And how much of it is for staff to go to follow-up training, but
For training.
yeah, so that it shows that this is imperative. This
Yes.
amount that.
Yes. So basically for Medicaid, that's 180,000. Out of that is 180,000. And then for MIP, it's 50,000. So those, and the rest is for employee as well as for foster care when they go for travel with the kids.
Okay, and what percentage of that is for foster care? I mean, is for the clients, and how much of that is for the staff?
Clients, 180 on Medicaid and 50,000 on MIP. That's 230. So it's basically more than, I don't have a calculator, Speaker, but that's 230 of that. Total travel cost is for clients as well as
Okay, so
and foster care. Where is that? Sorry, Senator.
I think if you just tell me that your travel for your staff is probably 15 or 20 at most, and the rest of it is all, I just need that on the record so that when somebody asks, how is it possible that this department is competing with Gita in travel, it's because of the patients that they're sending to the various hospitals.
So total is 256,000. Of that amount are for clients.
Okay. Thank you. I just wanted to make that clear so nobody's...
Yes, so nobody is. Thank you, sir.
Though we are in austere times, what are the most vital positions in your division that need to be funded?
All of them, Senator. I presented to you the historical data, the number of people that we serve, based on the estimated population of 180, 38%. But based on 2010 census, that's more than 40% of the population of Guam is what the division serves. So we need all those vacant positions to be filled. Thank you, Senator. Speaker.
Thank you, Mr. Chair. Thank you again to you and to all the staff for all the work that you guys do. It's a very important division of the department. We were talking earlier about the positions that is needed there. One of the efforts we tried to move forward is a bill we introduced in coordination with you folks, Bill 207, which is it's the eligibility and welfare specialist to kind of, because we know the disparity. And I think one of the reasons, I was waiting for you guys to say it, is that one of the reasons why you have such a big turnaround is because of what you pay them. And so that Bill 207 is something that was to address this, was to change the pay grades of these two positions. So maybe I think we'll do it better if you explain it, and that so that the senators and you can go on record, and that's something we can work with the committee to hopefully try to get on and make that happen in the budget.
Okay. In comparison to other positions of the same functions, our eligibility specialists, that's the reason why we're having hard time, most of them transferring to revenue, to Department of Revenue and Taxation, to retirement, to other department. The reason being is because the pay is very low. So we cannot retain those staff. Even though in the beginning, that's just their stepping stone. So they come to our division, we train them, and then when they found a new position which is higher of similar, they go. So basically, the turnaround of staff is fast. So if you can introduce and if you can approve, if the legislature can approve that, hopefully we can retain our staff.
And so that's what is needed is to actually create this welfare program specialist and
yes.
also welfare program specialist supervisor.
Yes, the reason why we indicate welfare program is because our eligibility is integrated. Used to be SNAP is separate from Medicaid and separate from MIP, but now each eligibility worker process all those public assistance program, which includes CCDF, SNAP, Medicaid, MIP, and cash assistance program. Those programs have different requirements, and you can see how the staff will move from one program to another in order to determine if this particular client is eligible or not. Just the income guideline alone is also different. So based on our discussion, we provided you with justification on why we need to increase the salary of this eligibility specialist.
Okay, and we'll work with the committee and the speaker on this and see if we can include that. Okay, so thank you.
Thank you, Senator.
Good morning.
Good morning.
Ms. Angel, I just want to tell you, in all the years I've seen you testify before the legislature, and you've been doing it for years, as far as I can recall, You've always been very humble compared to, I think, the benefit that you actually bring to not just your department, but to the government and the people of Guam. As you pointed out in your testimony, I thought it was very good that you did that continuous receipt of federal funds is a very stable income for Guam, and funding vacant positions in order to keep that stability, I think it's important. If you could just be very clear about these vacant positions. So in option 1, there are certain positions that would be filled. Does that meet what you want? Is that what you think you need? Or is this the same as option 1, or is this different? This is
That's option 1.
okay, so this is option 1. And so is this what you needed? Because this shows total estimated cost for vacant positions to be $1.2 million, 1.3.
We have more vacant positions that's not funded, but this is the budget ceiling that was given to us.
What would funding more than this do for Guam?
We want to fill all those unfunded vacant positions.
What would it do? Which ones? I mean, so we looked at the staffing pattern. You would say even those that did not request an option 1, what benefit would it bring if we filled those?
It will bring more money to Guam because we can process all cases timely for SNAP, for cash assistance program, and for claims, medical claims. And at the same time, it will reduce our error rate because we do have penalties for untimeliness of processing application. So that may be eliminated if all the vacant positions are funded and recruited.
There's a when you said you needed in the Medicaid assistance program the PACA, it's currently funded as 0, that you would need 20 million to access part of the 100 million ACA funds. How much of that would we be able to access if we you're saying spent 20 million? Is that right?
Right. Depends on, because there are different FMAP or Federal Medical Assistance percentage. There's 90-10, so depends on the need of the client, the utilization. So if it's all 55-45, so most likely we'll be able to utilize probably 40. But if it's not, if some of them are 90-10, then we may utilize more. So it depends on the utilization of the patient because childless adult is 90% federal and 10% local. If it's all, childless adult, then 90%. So you can calculate if that's 20 million that we're requesting, so that's only local. So I don't have.
If it was the non-childless adult, what?
It's 55-45. Then of course that will be reduced by 40%. The federal that we're going to get. Yeah.
All right. What was this funded at before? How were you able to utilize this before?
I juggle the money within our division, and at the same time, our department, any lapse funding, especially for those positions that's not being recruited. So we take that money to fund, as well as the GMH pharmaceutical.
Oh, yes.
But
okay.
I've stated that 11 million, we cannot utilize that because the number of claims that GMH submit is really very low.
You know, for information, and I'm sure you're aware of it, Sanders, is that, with GRMC coming into the picture now, and, the 5-to-1 type, their claims, I don't know how much is outstanding, but with their claims, I don't think we'll have enough sufficient monies within our appropriation. I mean, it's huge.
So
I know
based-
when they first came out, they said we owed them $30 million, okay? But as we reviewed them, of course, we have to clean them out. Yes, it gets lesser, but you can see because of their per diem for 5,000, per patient, it is a problem, and I think Senator's aware of that. So, that's a government-wide problem that we need to face to see how we can fund that extra, 5-to-1 or 4-to-1, especially coming from the new hospital. Okay, with the appropriation that we have now, it's not enough.
Yes. In fiscal year 2017, we paid Guam Memorial Hospital 19 million on Medicaid, and we paid GRMC 30 million, and we're delayed in processing GRMC claim because they're not clean. So they're actually trying to resolve their issues. So once they resolve their issues on the submission of claims, those claims will be voluminous. And we're still in February on processing their claims. And it's not based on service date, it's based on the receive date.
All right. It was my understanding that CPS is 100% federally funded, the positions there,
Yes.
but that they are very short on personnel also in comparison to the referrals that have been made. And I saw your chart that shows the referrals increase, I guess, every year. But is there any plans to do any kind of local funding?
With regards to the referrals, not all of those needs to be acted on. That's why I indicated there the total number of clients under the CPS custody. As you can see, it's 246.
Yeah.
The total referrals those are only calls that they
Way above
receive,
that,
but
yes.
not necessarily those are the total number that is being investigated or that is being referred to crisis unit.
All right.
Yeah.
We've had a discussion with them about homeless children and
Yes.
the need. Talking with the Homeless Coalition, they think there's a need for increased CPS involvement with homeless children, and we were trying to assure that we could make sure there are places for these people to go if that is the issue that is causing the concern. But
Yeah.
is there a provision in this budget, an increase of $500,000 for foster care?
Yes, because of the new group home, we need to fund for it. It's currently being built right now.
So what would the $500,000 for operations do? What does that do?
That's the maintenance of the building.
Just maintenance? I mean, staff also, or just maintenance?
Because we have to contract it out also.
Oh.
Yeah.
So you
the
intend-
operations.
Can you just describe that for us? You intend to contract out like the
The
operations of a group
The
home?
same way
Yeah.
with Ali Shelter.
Okay.
Yes.
And you estimate 500,000, and how many children do you estimate would be there? Because my understanding is only 6
Overflow.
currently.
Yes, it's an overflow, but we still have to contract it out. We don't know how many children will be overflow, but we still have to budget that amount.
And so this estimate is based on an opening date of what?
Probably December. We move December.
And this was never
Of
funded
this
before.
year.
So this 500,000, does it come out of any particular area? Did you shift something around for that, or how?
That's the budget request that we provided. Of course, we reduce some areas like MIP. Yeah.
All right. All right. Thank you very much.
Okay.
In foster care, in the mornings when I wake up and I go through my mail, there's a new federal law on foster care. How is that going to impact this home and your responsibilities?
what specific federal law?
I don't have the name directly on the tip of my tongue, but I did call a number of people, and I know that Sarah Thomas and Teresa Ariola have gotten a group together. And is there anybody from BOSA that's with them in that foster care? What's the impact, and do we need to fund it? Is there something that needs to be done?
That's the foster care. No, it's not. It's not cost effective to implement that. The reason being is because those are for TANF clients, and currently we only have one under TANF clients. So I don't think that's cost effective to implement that program.
Okay. Sure.
Tess, is there anywhere else in the government that employs people that you think might be qualified immediately to help you process those claims?
There's a lot. That's the reason why we went through LTA to initially profile them. But, you know, the recruitment process is at Department of Administration. They check the number of years and all of those in order for them to qualify under the program. So there's a lot of applicants, but based on the determination of Department of Administration, if they don't qualify, they don't qualify. We get, like now, for CPURO, we only have one applicant. So,
I mean, do you think you need to change the qualifications description at DOA or not?
Our descriptions, our job specifications are on, we submit it to them, but on how they assess those, we don't know. So I guess we need to meet with them with regards to that, because we do receive some clients calling us why they didn't qualify, even though they have experience, but I cannot say anything about that. So I guess we need to discuss it with DOA on how they assess and how they determine if an applicant is qualified or not.
What about anywhere else where people are currently working in the government that could do this type of work?
Yes, there are.
Oh.
At Guam Memorial Hospital.
Where there?
At the accounting, and then at their quality management, they have utilization. The reason being is they're all there because their pay is higher than our UR.
I see.
It's one grade higher. Their pay grade R, and our UR is only pay grade M. So in fact, we have an employee there who used to be our employee. I made them certified. I taught them, but then again, they left because the pay is higher.
I see. Yes.
Yeah.
Thank you very much.
Okay. If you would introduce yourself and just at least get on the record so that I understand what this new foster care law is and the fact that there is no need to fund it.
Good afternoon, Speaker and Senators. My name is Elizabeth Ignacio. I'm a program coordinator for BOSA of the Division of Public Welfare. I believe that the law you're making reference to is the Federal Foster Care Reform Law. That was passed in March 2018, and at this point, it came as a surprise, I guess, to many states because it was probably, I believe it was hidden in the budget bill. And so as of right now, states still need to be given guidance on, what measures and a bit more about what the law is all about. But at this point for Guam, we are not required to participate in that law because that law is meant only for Title IV-E states. We don't receive Title IV-E for foster care maintenance payments. And only because, like Tess mentioned earlier, we did a database research last week, and out of our 216 foster kids in our custody right now, only one is TANF eligible. So in essence, only one child will be required to, meet the measures in the federal foster care reform.
Okay. No, I just saw that there was this. As it was put by Ms. Ignacio, it was snuck in that huge budget bill that went through Congress and nobody seemed to have read it. and there was this provision, and
Thank you.
what caught me was it said that it was going to have an impact on how foster children were going to be handled in the States. And I knew that there was this request for $500,000, and I wanted to make sure that it wasn't any prohibition against, that the reform was that they against housing them that way. Because that was one of my concerns. I wanted to assure that we're in compliance with federal law and not putting them in long-term homes and trying to figure out some other. But thank you very much for that.
I'd also like to comment that I've been doing some reading on that federal law, and there's changes that, if we had to follow it, it's not going to be beneficial for our children, because one of the things I recall in my reading is that they want to shorten stay in any congregate care to, I think, maybe weeks. Right now, we have children who have been in congregate care for like years and years, and only because there is no foster homes available for them.
And that was the reason why I was concerned, is because I was aware of the fact that they were going to have this change in how long you could keep them in
congregate care.
Yes, and whether or not we were going to be funding a home that was not going to be federally compliant, because I know that the reform is to make sure that these kids are out of
the system.
The system at the earliest possible date, and we don't keep them for years, which is the reason why I called around to a whole bunch of people to put together a group to try to figure out how to be able to address this, because I didn't want to be non-compliant, and I didn't want to, and I wanted us to have the heads up to know whether or not we should be funding the new regalo, or even what the impact that it would have on sanctuary, which is the reason why I called Therese. And I said, you better know to see whether or not this is going to affect whether or not we can continue to have these long-term placements as opposed to immediate home placements. And so I'm leaving it to you professionals to do that. It's just, with one eye in the morning, I saw that, and it alarmed me, because they're still my kids. And I wanted to make sure that we address that.
We're on top of that, Speaker, and we are analyzing it.
Okay, no, which is the reason why I got the group together, and I'm glad that you have a representative there. Okay. Well, thank you very much. Oh, wait. Your chair has.
Thank you, Mr. Chair. Sorry, just one more question I forgot to ask earlier. The MIP funding that you have here, does that take into consideration whatever adjustments you've made with the St. Dominic's? I believe you guys made some adjustments, right?
Yes, we did make some adjustment. No, it's not taken into consideration.
So what is required in terms of funding? Because that's a very important, they're the only ones that provide that type of care. So what is required? How much is required?
Basically, if you can give us the same funding that you previously gave, which is the 16 million, I'm asking, sir, and the ACA funding that we need, that will help us.
Okay, so just for the record, what was the adjusted rate that was provided to St. Dominic's?
It's 190 now per day.
But how much is it before? I thought it was...
that was 135, if I'm not mistaken. Yeah.
You said one is 119 now?
190.
190. Okay.
That was way back in 2007, if I'm not mistaken. The 135. Yeah.
Okay. Thank you.
It's 10 years. Yes.
Senator, just to make it clear, we are working with them very close. We realize that their expenses are going up, but they have to get when they justify their cost increase. The requirements there is they have to have a good audited cost report and how they derive at their costs. And I think right now that they're aware of that. So hopefully they can get the right people to provide that justification, and then, you know, if it goes too high, then we might have to ask the senators for more money for MIP.
Yeah,
No,
no,
but-
and thank you for that. I know that you're working with them.
Yeah.
See your people working with them. You know, I understand. I know what they've requested, and I know your concerns, but staying in that level of 135 for the past, 15 years or so, right? Or 10 years, we know that cost has increased. So please continue to work with them and help them, because it's a very important service that they provide there over in Barrigada. Thank you.
And just to show how much my concern for trying to get this ACA money out into the, though I'm loath to suggest LTAs and unclassified, which one of those two employee categories would be most beneficial to you to be able to fill those positions at the earliest possible time?
Of course, Senator, we prefer the non-LTAs because we have to train them and we want to permanentize them and we want them to continue working for us rather than, you know, keep on training new people. But for the meantime, the LTAs are helping us, and that's also giving them an opportunity to apply for the position and to get the position later on because of the training that they have.
This question's to Leo to work with downtown. How much of they're not qualified is passive-aggressive way of not filling the position right now?
Mr. Speaker, that's a tough question, but you know what I noticed when we work with them, you know, we say, you know, profile this, that, I don't know, and test hit in the spot. I think we have to really get to the people that are doing the reviewing, so that, you know, right, Tess? And I know Tess can do it, stuff, but with, you know, they're just overwhelmed.
No, I understand that, which is the reason why it seems to me that some of the people that you're sending up there, you know are qualified, or at least, and then all of a sudden they're determining they're not qualified. And so I'm trying to figure out whether or not they're purposely saying that so that they don't have to fill the positions. Because I'm getting a lot from all of the departments that we've had GG1s up there for processing since, yesterday we had a hearing where it was, they submitted in January or the start of the processing at the beginning of the fiscal year. The GG1 and the person's name has been at administration since January. It's now June and it hasn't moved. And then I realized that it may be an issue of cash, and though they haven't told you you're going to be 10% cut, it's actually what the university and GCC has been showing, that they're 16, 17, and 18%, but it's being done by not filling the positions or not filling the invoices because there is no cash to do that. And so I'm just trying to figure out how much of that is a way of being able to save cash by not picking
You know,
up.
Mr. Speaker, that's beyond us there. I mean, you know what I mean, okay? If we profile the individual as qualified, you know, we want it right away. But if they hold it, then, you know, Tess here gets and says, hey, what happened? And, you know, I mean, I think you know what I mean? That's beyond us, our right here.
As I said, I'm just trying to figure out how to get that $100 million out into the community. I don't care who it's paid to, but I mean,
just give us the local
just to
match,
try
that's all I'm saying.
to help stimulate this economy. And if there's a way that we can move the invoices from February, March, April, and May immediately, then my GRT is going to go up. I don't, because it's being paid to somebody. And so, anyway, I thank you very much. Again, Tess, you have been extraordinary, and I thank you and your staff for all that you guys do and how much you infuse into this community. And so I've always tried to bend over backwards trying to give you money that you keep saying you don't want, and you're a really good soldier saying that's my budget cap.
I will say we need it now. Thank you, Speaker. Thank you, Senators.
Yeah. We're in recess until 2 o'clock this afternoon when we continue with the other divisions. Okay?
Okay.
Thank you.
Thank you.